Hey everyone, I'm Dr. Mache Seibel. I'm so excited to be here in Orlando, Florida at the annual meeting of the North American Menopause Society. We've got experts gathered here from all over the world to bring you the latest information on menopause. I'm so excited to share this information with you.
Let me ask you to introduce yourself.
Hi Mache, I'm Mary Jane Minkin,
And you are?
a gynecologist and NAM certified menopause practitioner. I'm here at the menopause meetings in Orlando.
And you just gave a wonderful presentation on?
Well, I don't know if it was wonderful, but I gave a presentation on vaginal estrogen therapy.
And tell us what you found.
Okay. Well, this was a study of women who were using vaginal estrogen tablets. There are many different forms of vaginal estrogen that one can use. There's vaginal estrogen creams, rings, and tablets. And the question is that although they're all effective, the questions arise is what motivates women to use one method as opposed to another. So this was actually a survey of women who were happily using the vaginal estrogen tablets who had switched previously. Most of the women had switched from the use of a vaginal estrogen cream, although a few had switched from a ring previously.
So these are women who came to be using a tablet vaginally, who may have been using another type or form of estrogen.
Correct. And what we were looking at is why did these women switch? What motivated the switch? Were they happy with their new product? And indeed, these women seemed to be quite happy with their new product. It was a survey of about 80 women, and the women were evenly divided. Basically, about half the women were under age 58, half the women were over age 58, and they had vulvovaginal symptoms of vaginal dryness or pain with sex, or urinary symptoms, frequent urinary tract infections. And it was interesting that the women, basically in the older group and the younger group, had about the same kind of complaints as far as vaginal and urinary symptoms. And that the women cited reasons, things that they were, why had they switched, that they didn't like the messiness of the cream leaking out, they didn't like to use the applicator and clean it out afterwards, they thought it was not hygienic, some of them were concerned that they were not using the lowest dose of estrogen possible, and of course the North American Menopause Society has a set of guidelines that say that you should use the lowest dose.
So these were aesthetic reasons that caused them to seek another option.
Right. Aesthetic reasons are also concerns about health issues. And these women seem to be quite satisfied with their choice. The reason the ring users had switched, some of them were unable to remove the ring easily. Some women could feel it with sex. Some women noted their partners could feel it with sex. And that motivated their choice of change.
And so 100% of the women had switched to a vaginal tablet.
Right.
They had switched from rings, creams, and
some had used both.
And different kinds
previously.
and had made a decision that for either aesthetic reasons or the belief that for health reasons, they preferred the vaginal pill,
Right.
and that, in fact, was a satisfactory experience and was helpful to them.
Right. Exactly, and they were satisfied with their choice. They were more compliant with its use, used it more regularly. They felt they were getting good effectiveness from it, and they liked the less leakage and the more of the, as you pointed out, aesthetic reasons they preferred it.
Any other things you want to add?
Just that we have a lot of ways to take care of women as far as vaginal dryness, and that I think just to emphasize to our listeners that there are certainly very nice over-the-counter remedies for vaginal dryness, products like Replens, things like that, and of course lubricants for sex. But if women aren't achieving as much comfort as we'd like them to, they shouldn't have any hesitancy to talk to their healthcare providers about alternative choices, including many choices of vaginal estrogens, which are quite effective and quite safe to use.
Thanks a lot.
Thank you, Dr. Seibel.